Hello everyone, welcome to Talk Here with Dr. Laz, your favorite health program on television, reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, as you can see today, I'm bringing the show from the streets. This is the streets of Abuja. And we are going to be talking to citizens because as 2023 election approaches, and of course as campaigns are going to be starting very soon for both the presidential, National Assembly, governorship and state assembly elections, we need to hear from the Nigerian people what they want to see the next president and the next set of governors do in the health sector in order to ensure that we get quality health care and also ensure that we don't keep losing many of our healthcare professionals to other countries. So we are going to be talking to a lot of Nigerians in different parts of Abuja. So we are on the streets. And we hope you watch the program, and also don't fail to share your own views through our social media channels as well as the communication platforms that's going to be displayed on your screen. And if you are yet to subscribe to our YouTube channel, this is the time to do so that you watch our previous episodes free of charge and also the ones that we're yet to do. Keep watching. We'll be right back after this break.
They should employ more medical personnel and also pay them well.
What I would want the incoming administration for 2023 to be like is people who are going to lead by example. So people who would entrust the system to look after their own health as against the health tourism, taking our scarce resources to other countries for healthcare services. So I want them to focus on funding the system within. Now, what are those things they're looking for outside? They go outside, they see this elaborate, well-equipped hospitals. Bring what you have seen out there, bring it in. The doctors, I don't think we lack doctors because other countries, we are training the doctors. There is a brain drain right now in Nigeria. Doctors are going overseas to all these countries, to Holland, to the UK, to Canada, to US, and all that, Saudi Arabia and Dubai, here and there. These same doctors, give them the enabling environment. So what I want from the incoming administration is basically the enabling environment. And then leading by example, patronize the system. Because what we've heard is that these same great doctors who are not being well taken care of in Nigeria, they are the same doctors that they are seeing overseas. And they are, getting landmark results and all the landmark surgeries and discoveries abroad. We're hearing Nigerians, great names out there. But these are the people who would have bettered our system here in Nigeria. So what I want are those who are going to focus internally, so provide more funding. Yes, so I'm a proponent of health, education, the basic human capital, build it up. Just provide the basic amenities and facilities. We don't have to be going out there for all this tourism and healthcare. So yes, that's my priority. They should focus that, and not only that, funding too will also affect the healthcare workers, the doctors, the nurses, and the entire sector. When you fund them, their welfare will be taken care of. So I don't have to travel. You doctors, you don't have to queue at Saudi Arabia embassy because you want to go to Saudi, you want to Jakarta. So there's a huge brain drain. When you take care of the welfare of the doctors, when you fund them, the residency is well taken care of. All the strikes and all these stuff we hear every now and then happen will cease to happen. So I think that's just my advice. Patronize the system internally. Send your children and your wife to these hospitals within Nigeria, create the right policies, and then lead by example. Look at the vice president recently had a surgery in a local hospital here. What that is saying is that it is possible. We have the equipment, we just need to provide more funding, and a whole lot of these facilities will be available. Then go into public partnership, bring those expertise, partner with them, do a PPP, and I'm sure you'll be able to get back your returns on your investment. So these are just a few things. I hope they will listen and then they would apply this come to an end. And then citizens must look out for people who are going to, let's ask the right questions. Let us ask these people, so what is your health care plan? You know, let them read out these figures to them, the mortality rates, the health care, the death rates, and all that, the delivery rate. Let us give them these figures so that they can speak to it. From there, we can know those who are looking at the statistics and who are going to make informed decisions based on these statistics that is available to them. How are you going to reduce these? How are you going to sanitize or, create an enabling system? What is the health insurance for the common citizen, for the market woman, for the self-employed? With 10,000, with 5,000, can I get just basic health insurance? You know, these are the kind of policies we want. You know, so let's ask these questions. If they're able to answer these, then we'll know those who are going to take health serious. Like they say, health is wealth.
The state of our healthcare system needs a total redemption. Currently, we are looking at we are seeing the ASU strike, and just believe it that in the next couple of months, you will see other health sectors going on strike, the JSU, the resident doctors, and every other bodies in the health sector. So we want the next president to build a strong health structure that will not give room for people to go on strike, because end of the day, if it is the patient that is going to take the blunt of whatever is going to happen. So whatever that will bring or will cause the healthcare professionals to go on strike, if it's equipment, personnel, training, the government should make sure that all those stuffs are made available. Also, from the on the state level, we see when elections are coming, governors or political aspirants painting the primary healthcare centers, and after painting it, when you enter there, you can't see any medical equipment, you can't see any I hardly see any primary healthcare center that is functioning optimally. So beyond the campaigns, once you get to see it, make sure that we have the 6 building blocks of the healthcare system fully working whenever. Like for instance, if somebody goes to any healthcare facility, the person should be able to access care. Whether the person from any part of the world should be able to access care. So it's not just painting the hospital, and when you get there, you can't see any functional equipment or any healthcare professional on ground. So there also should be ways whereby we can promote and make sure that things that are, like for instance, when we see donors coming to give some support to primary care centers, it's after some time when those donors leave that primary care center, we see that the government don't take over their responsibility, leaving what the donors have done to just waste like that. So there should be continuity in whatever that is being on ground to help promote the primary healthcare system, because that is the grassroots for every quality healthcare system in a country.
I want them to make some lot of facilities and employment, because we have lack of doctors. Now for using a doctor, it takes some time, and it might even take you up to 3 days, 2 days. They say doctor is busy, doctor is that, and before you know the patient, you might end up losing the person. I think what the next present government has to do for us is to create more job employment, employ more staff, and also some facilities.
We need a free medical attentions. Rural development, cities, we need a free medical. Somebody will come to hospital, ordinary cotton wood, he will buy. There's nothing you come to hospital is free. They just turn hospital to be like a market, which we need. We have some countries that whenever you go to hospital, you have a free medical attention. We need to improve the quality of our medical facilities, the supply. Government should give a free medical attention, free card, free bed, free everything. Let government focus on hospital and agriculture.
We lack, there's so many lapses on health as a thing. So first of all, the new governors or the president, I would like them to first of all improve the life of mostly the youth and create more platform. So that, because most of the health centers now, if you go, they might have all necessary equipment, but they lack staff, manpower. You don't have most people. And there are so many guys on the streets, young people on the streets, who actually by now are supposed to be in one of these areas. in the health. Just like if you go to the health center, you'll be looking at one person attending to like 10 patients, writing names, and there should be platform for those areas, customer care services and all those things. So I want them to employ more youths in the field of health, empower the health centers. Let there be some kind of functions, some kind of position that have been occupied. Health center of a thing are not like other sectors. If you're not healthy, you're nothing. You can't meet up. So they should work on that area in the sense that apart from employing more manpower, there should be more equipment available, mostly in the rural areas where there are no much hospitals, clinics, health centers. Those areas where they have more of this, there should be more manpower.
I want them to equip our primary health care center all over Nigeria, because they are the closest closest hospital to people, to masses. So we want them to equip them and fund them, and they should make it standard so that our primary healthcare sectors can be improved and function very well. They need to increase the budget of the health. They need to increase in our budget of health in this country. So, we have lost a lot of doctors in Nigeria. Doctors, midwives, nurses, all of them, most of them are running out of this country. So going to other countries, and they are succeed over there. So I think our government should try and find solution to it, to try and fund them to do what is needed to be done in this country. They need to focus more on our health sectors.
Welcome back to Talking with Dr. Laz, your favorite health program on television. Yes, I'm at Area 1 shopping complex, Garki area of Abuja, Nigeria's capital city. And we'll be talking to some persons here. I'll still hit back the streets as citizens keep setting agenda, expressing what they want to see in the Nigerian health sector, especially as we go to the polls in 2023 to elect or re-elect new set of leaders at the state and the federal level. Keep watching. Yes, let's get the experience. Women usually use hospitals more often than men. And I have Mrs. Adubuari, right?
Yeah.
Okay, so can you share your experience using any public or private hospitals here in Abuja?
My experience with private and public hospitals, government hospitals in Abuja has been I can say they are both good and bad.
Okay.
Like the good one that I've attended, I think they really tried, but it's just that the facilities are overstretched. Most of the times, you have to wait, you have to leave your house like 7 o'clock in the morning. Then you now wait. When you get to the hospital, you take this, they say go that way, and go this way, Before you do all those things, if you are somebody that is not, you are not feeling fine, you won't be able to do that. So that's why most people go to the private hospitals and then do whatever they need to do.
Okay. Which hospitals are you making reference to?
I'm making reference to Federal Medical Center in Abuja.
Okay.
Jabi. They are really trying. The doctors, they are well qualified. They attend to people like their sisters and brothers, friendly. But the area in which they need to is that maybe the areas of going, like directing you to go this way, go that way. Before you know it, you're already getting to 3 to where you miss your way, you go back. Then some of the places you have to climb upstairs. What about somebody that is not feeling fine? You cannot climb. Maybe you have a bad leg, or maybe pregnant. You are even having issue with pregnancy.
Right.
So you have to. I think in that area, they have to work on that area.
Okay.
But they attend to people very well.
Okay, so right now there's election next year. So what do you want to see? What do you want the next president or governors at the state level to do to make our health sector work much better?
And they need to get more equipment for the hospital. I told you that the equipment that they are using in most of the public hospitals, they are overstretched. In which when you go to private, you can just do what you will do in a public hospital for 6 or 7 hours. You can do it within 1 hour in the private hospital. But it's not everybody that has money to go to private hospital, because private hospital in Abuja, they are very, very expensive. And then, so with all this one, let the new government that are coming, the governors and the presidents, let them try and then equip the hospital more than ever before. Get more equipment. Let them have some of the when you go to the hospital, they will check your data. I mean your
records.
Your records. Let there be maybe computerized ones that immediately you get there, you type your number, everything about you will come out. You don't need to be carrying card up and down. Then secondly, let them get maybe all this thing that the BP machine, they can. Do you know that people will queue like this? They will be fighting. That I came before this person. Why is this person coming now? They're supposed to attend to me before this person. So if they have 10 of that machine, or even 20, that you have different tables, people will just within 1 hour, 2 hours, they have gone. I think the hours we spend in hospital is too much. So it's reducing the productivity of the country, even when you want to look at it generally. So they have to bring more equipment. Then in welfare of doctors, they should take care of it too, because they are really trying, so that most of them that are good will not travel abroad. So many of them are going abroad these days, and it's not good. Those people that our leaders, they go and meet abroad, they are the same people that left here. Why they not just try and make sure that they are okay here, so that when they are okay, you don't need to go. Like our vice president that just had his own surgery here, and it was okay. You can see if he had traveled abroad, the expenses and everything, even the time is a waste. So I think it's better to have more equipment here. Let them take care of doctors and even the whole sector. Not only the doctors, the people that are attending to nurses, the other attendants in the hospital. Then most of these places too, I think they needed more houses. So there is need for more houses, because it's really but my experience about the state hospital, I learned that there is no equipment there at all. That even Abuja is better. Kwara State, to be precise, the facility there is very, very poor. Very, very poor. So
I believe the governor of Kwara State is getting the message. He's saying it's his first term. If he gets re-elected, or if a new governor comes up, whoever it is getting this message to ensure that they make the health sector better. And not only Kwara, every other state in the country.
Like Ekiti, Ogun, they should try more and make sure even our brothers in the east, if it happens that Obi comes up, let them to equip the hospitals, give the necessary enumeration to the workers so that they can work effectively and efficiently.
Thank you. Whoever becomes president has the entire country as his constituency, so thank you, ma'am, for sharing your opinion.
Thank you. Thank you for having me.
I want to also use this opportunity to call on the Abia State government, because I graduated from Abia State University, and I did my posting and my clinical school in Abia State University Teaching Hospital in Aba. And it's worrisome to know that I stand now, that place is under lock and keys. And it's also worrisome to know that that the Medical and Dental Council of Nigeria have withdrawn the accreditation for medical students. All this has effects, and it affects the stay of every student, mostly the medical student over there. And I'm calling on the Abia State government to redeem that place, and also the next government should prioritize the healthcare sector, prioritize the teaching hospital. That's the only teaching hospital in Abia State, and we can't afford to say that their workers are being owed for how many months. These are people's father, mother, they have responsibility to take care of. So it would be so appalling that we are preaching for a quality healthcare system, and Abia State that trained me, absolute that trained me, is on the lower. When you place it on the table, is very low. So I want the next governor to prioritize healthcare, pay healthcare workers, make sure that nothing like strike happens in that institution, because it will affect whoever that want to send their word to that place for any medical education. And let's know this true, that the more we have exodus of medical professionals, we need to also not stop the production of medical professionals. So please, the Abia State government and the incoming Abia State government should prioritize healthcare and make sure that ABSUT don't go on strike anymore.
Variety of opinions there from citizens of Nigeria and what they want the next set of governors and of course the next president of Nigeria to do towards improving the quality of healthcare and of course the access to quality healthcare delivery in the country. Campaigns for the presidential elections in 2023 and the National Assembly election is going to commence on 28th of September 2022 and 12th of October also in 2022. And I know political parties are already gearing up, support groups are doing a lot of activities, which includes street rallies, creating awareness on various issues. Usually, violence related to politics tend to go up around election periods. I just want you to know that the Violence Against Persons Prohibition Act 2015 forbids all forms of violence, including political violence. Of course, be it emotional violence or anything, threat to violence is also punishable by law, according to the Violence Against Persons Prohibition Act, which has been domesticated in more than 2/3 of the states in Nigeria. But something happened over the last weekend. In the Ebonyi state of Nigeria, it was reported that the police, shot canisters and tear gas to disrupt a rally by a group of supporters of one of the presidential candidates. I watched that video and I found it disturbing. And of course, the video clip is showing on the screen. On the streets where you have keke moving, vehicles moving, and suddenly, tear gas or canisters were shot with fumes. And what was going through my mind is, assuming that you have an asthmatic patient in any of those vehicles on the street, what could happen? Of course, you could recall that many years ago, a former Senate President, Chuba Okadigbo, was reported to have died from the fumes he inhaled during a protest in Kano State. So please, I just want our law enforcement agents to understand that there are health implications to some of these acts. While I'm not a lawyer, to be able to justify the legality of what happened, I'm really more concerned about the health aspect. If you want to, if there is no clear case of violent acts, and you want to disperse persons, and you have passers-by and vehicles that are moving, just know that just random use of such, which in this case had been roundly condemned by a lot of persons, could be endangering the health of innocent persons, residents on the street who may have one health condition or the other, including elderly people who may have chronic obstructive pulmonary disease. that kind of reduces the vital capacity or the oxygen retention capacity of the lungs. So those are part of my last words. Please, let's avoid all forms of violence, be it physical, emotional violence, as the campaigns will be starting very soon. Also on this program, we'll be having a segment, My Health Agenda 2023, which will bring governorship candidates and hopefully the presidential candidates to discuss their health agenda with the Nigerian people as well as indigenes of their respective states. This is very important because health is very topical. COVID-19, monkeypox, Lassa fever, and a lot of outbreaks, as well as the high level of immigration of our healthcare workers to other countries is something of concern, as many persons you just watched have expressed, as well as so many Nigerians have these concerns. So feel free to reach out to us through our communication channels displayed on your screen. If you are a governorship candidate or a political party and you want to share your agenda on health with the Nigerian people, we'll be very glad to talk health with you. Thank you for watching. My name is Dr. Lars Eze. See you same station, same time next week. Bye for now.